are all true, but there are only a few of the symptoms of autism because autism is a spectrum disorder, which means their symptoms can differ and present themselves differently. This means that some people are affected by autism more than others. Some professionals call it mildly, moderately or severely affected, high functioning or low functioning, requiring support, substantial support or very substantial support. Now we hope this video gives you a clearer picture of what autism is.
Firstly, autism is a neurodevelopmental disorder. This means that it affects the development of the brain and it presents itself in early childhood. Now, because there are no physical features, parents may not realize anything is different until perhaps their child does not show any gestures like pointing by the age of 12 months. Perhaps they have little or no single words by the age of 16 months, and perhaps they don't respond to their own name. These are all called red flags, and you can visit our website for a full list of red flags. When a parent or a pediatrician notices some of these red flags, it is very important to seek out a professional diagnosis from a trained, recognized professional, such as a clinical psychologist, a child psychologist, a developmental pediatrician, or a psychiatrist. An accurate diagnosis of autism must be made using the criteria set by the DSM-5. Now, the DSM-5 really describes autism in two broad categories. The first are deficits in social communication and social interaction, while the second are restricted, repetitive patterns of behavior, interests, or activities. Under category A child needs to meet all of the following three symptoms. Deficits in social emotional reciprocity, which includes possibly challenges with reciprocal play, difficulty in back and forth conversations, perhaps difficulty in initiating or sustaining social interactions. Secondly, deficits in nonverbal communication, perhaps no eye contact, or difficulties with gestures such as pointing or other body language. The third is deficits in relationships, and this can range from no interest in friends to just difficulty making and keeping friends. Remember, a child needs to meet all three of those sub-symptoms in order to attain a diagnosis of autism. Under category B, a child needs to meet two of the following four symptoms. Firstly, stereotyped or repetitive motor movements, use of objects or speech. Some of the examples of this include hand flapping, lining up toys, or repeating phrases. Secondly, insistence on sameness, or in other words, certain inflexibilities, such as wanting to eat the same food every day, using the same road, or wearing the same clothes. Thirdly, highly restricted or fixated interests that are a bit abnormal in intensity. For example, a strong attachment or preoccupation to certain cartoon characters or certain interests ranging from Thomas the Train to Angry Birds to whatever it is that fascinates that child. And fourthly is anything sensorial, whether the child is hyperreactive or hyporeactive, which means oversensitive or undersensitive to certain sensory stimulation, which can include lights, noises, or even textures. Now remember, a child needs to meet two out of the four mentioned symptoms in order to attain a diagnosis of autism.
So, to recap everything that has been said, autism is a spectrum disorder and it is a neurodevelopmental disorder. There are no physical features and symptoms can present themselves in early childhood. Accurate diagnosis needs to be made based on the DSM-5 and no two individuals with autism share the similar degree of difficulties. That, in a nutshell, is what autism is. Thank you for watching.